I will be performing a newborn assessment on a 2-day-old male. So as I enter the room, I would make sure to gel in. I would introduce myself to the parents and I would say, "Hi, my name is Katie. I'll be your student nurse today helping out. I am here to do an assessment on your newborn. Is that all right with you?" Before I put my hands on the baby. After that, I would make sure to assess the infant's ID band, and I would double check that with the mothers and double check that in the computer system. Then I would talk to the parents, ask about how the baby is feeding, any recent voids or stools, wet diapers, things like that. Next, I would put on gloves and I would get all my vital signs equipment. The first thing I would do is listen to the heart rate for a full minute at the 4th intercostal space on the left side. I would use my stethoscope and listen for a full minute using my watch. The normal heart rate range for an infant is 110 to 160. Next, I would listen to the respirations. I would use my stethoscope again, and I'd also watch their chest and stomach rise and go down. I would listen for a full minute, and it's important to do that because infants can kind of have a sporadic breathing pattern, so you want to get an accurate rate. And the normal rate for infants is 30 to 60. So I'd listen for a full minute using my stethoscope. Next, I would take a blood pressure. I would wrap it around one of the arms, making sure it's an appropriate cuff and that it's comfortable. The normal blood pressure range for an infant is 60 to 80 for diastolic and 60 to 80 for systolic and 40 to 50 for diastolic. And finally, I would take the axillary temperature in the armpit. I would do this last because it's the most invasive and infants usually don't like it that much. And if they get worked up and start crying because it's cold, that can affect their respiratory and their heart rate as well. So I would place the thermometer underneath their armpit and hold it there until the vital signs machine lets me know that it's done. A normal temperature for an infant is 97.7 to 99.7. After that, I would put the vital signs machine away, and then I would begin my assessment. First, I would note their posture. They should be flexed, and movement should be symmetrical when they do move. I would also, throughout my assessment, be looking at their skin. It should be pink, making sure it's not too moist or too dry in any one area. I'm also noting the lanugo and vernix, if it's sparse, abundant, patchy, lacking, anything like that. I would also make sure when I assess their skin to look for blue nevis, strawberry hemangioma, port wine stains, and also if they're having any pallor or cyanosis. Next, I would assess the fontanelles, the anterior and the posterior fontanelle. I would do that by palpating, and we want to make sure that they're soft. There shouldn't be any depression or bulges. We would also look at the suture lines and assess the molding of the infant's skull. Next, I would look at the face. I would make sure that the facial features are sized appropriately for the infant, that they're symmetrical on either side, and that they're symmetrical with movement. Then I would move to the eyes. I would check to make sure that the irises are blue-gray, that the sclera is clear, and there's no jaundice. I would use my pen light to check and make sure that the pupils are equal and responsive to light, and there shouldn't be any tears at this point on a newborn infant. While I'm doing this, I'd also be assessing their breathing, so looking at their nose. Infants are nose breathers, and so I'd want to assess to make sure that there's no nasal flaring, because that would indicate that they're in respiratory distress. And finally, the last thing I would assess on their face is their mouth. The oral mucosa should be pink and moist. I would make sure that the tongue movement isn't inhibited I would make sure that the hard and soft palate are formed and intact, and also I would check to make sure that there's no cleft palate or anything like that. Finally, I would assess the ears. On an infant, they would be a little bit different, but I would assess the pinna and make sure that it's firm and also that there is quick recoil. Next, I would look at their neck, make sure there are creases, it's short, but I'm making sure that they have movement and it's flexible. Then I would move to the chest. It should be barrel shaped, symmetric on each side with movement, with inspirations and exhalations. And I'd want to make sure there's no retractions of the chest or grunting, because that would also indicate that they are in respiratory distress. The abdomen should be soft and round. I should be able to hear bowel sounds. I would assess with my stethoscope. The abdomen shouldn't be distended, and we wouldn't want bowel sounds to be absent. While I'm here, it's a good opportunity to teach the parents about umbilical cord care. So I would engage them in conversation, just like I'm doing throughout the whole assessment, letting them know what I find. But I would talk to them about how the umbilical cord will usually fall off within 7 to 10 days. It's important to fold down the diaper so that the umbilical cord can dry out. We wouldn't want there to be any bleeding or drainage or foul odor, bad smell. So we'd let the parents know to keep an eye out for that and let us know if they notice that happening. So like I said, my patient is a male, so I would assess the genitals. I would make sure I would take the diaper down, not off all the way, but just enough to expose the penis so that I'm able to do a full assessment. I would make sure that the meatus is centered and that the testicles have distended. While I'm here, if the infant has been circumcised, I can assess that as well and educate the parents about circumcision care. So as a nurse, you would want to assess circumcision site every 30 minutes for the first 2 hours after, and document the first void. Make sure that you're assessing the pain and documenting the pain as well. In educating the parents, you'd want to let them know that petroleum jelly is used around the site. It can be cleaned with warm soapy water. Around day 2 or 3, there might be some yellow discharge from the site, and that's completely normal. However, the parents should be looking out for any bleeding, swelling, signs that the infant's in pain, and they would want to let us know about that. So then I put the diaper back on. Then I would move to assessing the upper extremities of the infant. So I would gently move the extremities around, making sure that they have full range of motion. I'm making sure that they have flexion and extension. And also, while you're here, you can assess the palmar grasp, where the infant grasps one of your fingers with their whole hand. Then I move to the lower extremities. Once again, I'm making sure that they are symmetrical in length, full range of movement. I'm also assessing for any cleft foot or anything like that. At this point, I would want to gently and safely turn the baby over onto their stomach so that I can assess the gluteal folds in the back. I would take down their diaper, make sure that they are symmetric and equal length on both sides. While I'm here, I can also assess the anus. It should be patent, and this is a good opportunity to talk to the parents about the most recent poops and pees of the infant and how many wet diapers they should be expecting at this stage. So like I said, the infant is 2 days old. So on day 2, we would want at least 2 voids and 2 stools. And the stool would be thick, dark, and tarry. And that's something we want to communicate to the parents so they know what to expect. After that, I would put the diaper back on and assess the spine. It should be intact and flexible. No humps or tufts of hair or dimples. Then I would rotate the infant back over onto their back, make them comfortable in bed, and then I would continue on with patient education. We want to make sure that the parents are aware of safe sleep practices. So the infant should always sleep alone in a crib or bassinet. They should always be on their back, even if they can turn. There shouldn't be any pillows, stuffed animals, blankets in the crib. They should just be wearing a sleep sack. You want to dress the infant how you would yourself so that they don't overheat. The mattress should be firm with a fitted sheet, and you should always place the infant in the same position every time. We also want to educate about feeding. So depending on if they are breastfeeding or bottle feeding, it's a little bit different. For breastfeeding, you want to breastfeed on demand, or when you notice cues from the infant like rooting, crying, things like that. But you want to make sure that you are feeding 8 to 14 times within 24 hours is what is recommended. You don't want to reheat breast milk in the microwave. And for storage purposes, breast milk can be stored at room temperature for 4 hours, in the fridge for 4 days, and in the freezer for 4 months. If the mother is bottle feeding, you want to make sure that the formula includes iron. You don't need to sterilize the bottles, but you would need to wash them in hot soapy water. Don't heat up the breast milk in a microwave. You can use a bottle warmer. And before you feed the infant, make sure that you test some of the formula on the parent's skin to make sure it's not too hot. When you are bottle feeding your infant, make sure that the bottle is not propped up somewhere and that you actually have a hold of the bottle as well. For bathing needs, we want to educate the parents that infants really only need 2 to 3 baths a week. More than that, and their skin will get dried out. You can use warm soapy water, and usually in the hospital we would teach them in the sink with the basin of warm water. And after that, I would make sure to ask the parents if there's anything else I could help them with, if they had any questions, or if there's anything I could do to make them comfortable. I would make sure to document my full assessment, leave the parents with the call light, and I would gel my hands out. And that is my newborn assessment.